Urgent. HMPV warning as virus cases double in UK in just 2 weeks. The UK Health Security Agency, UKHSA, has warned Brits to take precautions over the bug, with rising cases of HMPV recorded in the UK and US in recent weeks. Doctors and public health officials globally are raising the alarm over a surge in cases of the hidden symptoms virus HMPV, as data reveals that the rate doubled in the UK within a fortnight. The UK Health Security Agency, UKHSA, has reported that the percentage of respiratory problems in hospital testing positive for this potentially lethal illness stood at 4.53% in the week leading up to December 23, the most recent statistics available. However, the actual figure is likely higher. In comparison, the percentage was at 2.42% in the week leading up to December 9 earlier in the month, the Mirror reports. The virus, also known as human metapneumovirus, is already wreaking havoc in China, while a spike in cases has also been noted in Malaysia, India and Kazakhstan. Meanwhile, Centers for Disease Control and Prevention, CDC, data has also shown a doubling in the number of US cases between the start and end of December, with 300 positive test results in the final week of the month. The CDC stated it was monitoring cases in China, but they do not believe there is currently a cause for concern in the US. Symptoms of HMPV, often mistaken for those of a common cold or flu, include coughing, fever and a blocked or runny nose. Cases typically increase in the winter when the weather is colder. Although typically less severe than COVID, HMPV poses a significant threat to vulnerable individuals, including young children and those with weakened immune systems, such as cancer patients undergoing chemotherapy. According to Dr. Andrew Catchpole, a scientist at HVIVO, HMPV is a common component of the winter cold causing viruses in most countries, exhibiting seasonal patterns. Dr. Catchpole noted, "It is not usual to be a major concern for high numbers of hospitalizations, but it is unclear just how high the numbers are or if issues are arising purely due to coinciding with high flu and COVID levels." Quote, "To mitigate the risk, Brits are advised to prioritize regular hand washing and consider wearing masks in crowded areas. Where possible, it is recommended to avoid crowded places altogether. Additionally, those eligible are encouraged to receive their winter flu vaccines if they have not already done so." Dr. Catchpole further clarified, "Whilst HMPV does mutate and change over time with new strains emerging, it is not a virus that we consider to have pandemic potential. This is because the changes in HMPV are gradual and based on previously circulating strains."